ever felt that nagging feeling like maybe, just maybe, you're missing something crucial about a patient, or found yourself jumping to conclusions based on limited information? You might find yourself saying, something just feels right about this. Get ready to have your mind blown. Today, we're diving deep into the sneaky world of cognitive biases and uncovering how they can trip us up as SLPs. But don't worry, I'm also equipping you with the knowledge to outsmart your brain and become a bias-busting clinical superstar. Hi, I'm Teresa Richard. I've been a medical speech pathologist since 2008. I'm a board-certified specialist in swallowing and swallowing disorders, and I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Author of the best-selling book, So You're Having Trouble Swallowing, and host of the Swallow Your Pride podcast, which has over 5 million downloads. Welcome, I am so glad you are here. Why our brains are wired to make mistakes. The late great psychologist and behavioral economist Daniel Kahneman separated our thinking brain into two distinct parts. One is the imaginatively named System 1 thinking, which is also called fast thinking. It's the part of our brain that we use for quick decisions where time is of the essence, or for those decisions we've made 1,000 times that don't necessarily require deep conscious thinking. The other name, again, dripping with creativity, is System 2 thinking, or slow thinking. This is the part of our brains that we might use for those decisions that require thoughtful consideration. Planning a wedding, for example, or choosing a place to live. These are highly complex, high-stakes decisions that we are going to want to think about a bit first before jumping to any conclusions. Imagine this. You're walking through a jungle, you're making your way through the thick jungle weeds, and suddenly you spot a slithering shape in the grass. Do you stop to ponder if it's a harmless garter snake or a venomous viper? No, your brain screams danger, run. That's our trusty System 1 thinking. Fast, instinctive, and essential for survival in the wild. And it works, especially when we need it most. But today, most of us no longer live in a world where we are constantly bombarded with life or death situations. Thank goodness for that. But here's the catch. In the complex world of healthcare, these snap judgments that have benefited us for hundreds of thousands of years can lead us down the wrong path today. And to make the best decisions for our patients, we need to engage our System 2 slow thinking, the thoughtful, analytical part of our brain. Biases, a tour of our mental traps. Okay, my friends, let's take a look at some of the most common biases that plague our System 2 thinking and steer us closer to our System 1 thinking, which often results in the knee-jerk reactions we don't want to be making in dysphagia management. The order effect is where the order you gather information in influences your perception. An example might be doing a chart review before meeting the patient, which might make you overemphasize certain details and make certain assumptions about the patient before you even meet them for the first time. This isn't to say that doing your chart review first is a terrible idea. Sometimes it's a necessity, but there are benefits to meeting your patient for a short while before you review your chart and finish your clinical assessment in order to balance the information you receive and avoid this cognitive bias. Confirmation bias, where you only see evidence that confirms your existing beliefs. You sort of become fixated on one piece of information and interpret everything else through that lens. For example, say a patient coughs during a clinical assessment. An SLP suffering from confirmation bias might assume the cough means they're aspirating, which would ignore the many other possible causes of a cough and might prevent us from exploring those other possible causes. The framing effect. We all see problems through a different array of frames that may distort our perception. A common example of this is when we give a detailed explanation of the patient's swallow to a colleague, only for them to turn around and ask, okay, but did they pass? Our team member is seeing the problem through a pass-fail frame when the frame we are looking through is way more complex than that. Zero risk. This happens when you strive for zero risk, even if it's unrealistic or harmful. For example, say you keep a patient NPO indefinitely to completely eliminate aspiration risk, ignoring all the other potential risks of keeping a patient NPO, like the impact of their quality of life or the risk of dehydration, malnutrition, and potential medical decline. By recognizing these biases, we can start to navigate them more effectively. And most importantly, we can move toward a more rational decision-making process that sees the whole picture for what it is. This is the best way we can more effectively serve our patients and achieve their goals. A new SLP grad was excited to begin her career at a skilled nursing facility. when she received a referral for a resident with a history of falls and difficulty swallowing. The SLP immediately honed in on the possibility of dysphagia. She carefully reviewed the patient's chart, paying very close attention to potential signs that aspiration was a problem, like her abnormal chest X-ray and her signs of infection. This further reinforced her initial hunch about dysphagia. During the evaluation, she focused primarily on swallowing, overlooking the patient's complaints of a cough that's been occurring for the past few days all throughout the day and at night, not only when she eats and drinks. Confident in her diagnosis of dysphagia, she recommended a modified diet and a referral for an instrumental swallowing evaluation. But then a physician pointed out that the patient's viral panel came back positive and that she wasn't suffering from aspiration pneumonia at all, but instead from a viral pneumonia. The SLP realized she'd been wearing blinders. She had fallen prey to confirmation bias, seeking only evidence that supported her initial focus on dysphagia, while neglecting other crucial factors that were contributing to the patient's overall health. We are just starting to scratch the surface of conquering these sneaky biases that can affect our clinical decisions. If you're already feeling empowered to become a bias-busting SLP, don't forget to hit that like button and subscribe to catch all my future videos on evidence-based practice. Now I'm curious, what biases have you encountered in your own practice? Share your experiences and any aha moments you've had in the comments below. Let's learn from each other and create a community of super smart, bias-aware SLPs. And hey, since you're clearly dedicated to improving your clinical skills, I've got a little something for you. Stick around to the end to snag a freebie. Becoming a bias-busting SLP superhero. Okay, we've unmasked those pesky biases. Now, how do we actually defeat them? Here's the secret weapon arsenal. Engage your super slow thinking. Remember that system 1 thinking? It's not always the enemy. For quick, everyday decisions, trust your gut. But when the stakes are high, like determining diet consistency or assessing aspiration risk, it's time to activate your system 2 and slow down. Analyze the situation, gather all the facts, and consider alternatives before making a decision. Activate your mindfulness shield. Being mindful isn't just for meditation. It's about staying present, focused, and aware of your own mental state. This helps you avoid autopilot, minimize distractions, and make rational decisions based on the evidence in front of you. Pro tip: set reminders, use checklists, and pay attention to your own needs to stay grounded and focused. Level up with experience. Just like any superhero, we become stronger with practice. The more patients you see and the more diverse cases you encounter, the better you'll become at recognizing patterns, identifying key information, and making accurate diagnoses. Challenge yourself, take on complex cases, seek out learning opportunities, and engage in case study reviews with colleagues to sharpen your skills. Recharge your superpowers. Even superheroes need to rest. Burnout and fatigue can cloud our judgment and negatively impact patient care. Prioritize self-care, maintain a healthy work-life balance, and advocate for manageable workloads to ensure you're always at your best. Develop your systematized X-ray vision. Create a consistent approach for every patient evaluation. This ensures you gather all the essential information and minimizes the chance of missing crucial details due to bias. Standardize your chart reviews, oral motor exams, and swallowing evaluations to maintain objectivity and thoroughness. And remember, the X-ray vision here is only hypothetical. No matter how heroic we become, we still need an instrumental swallowing evaluation to visualize what's really going on. Assemble your super squad, the interdisciplinary team. Don't forget your allies. Collaborate with the interdisciplinary team to gain a holistic view of the patient and bring light to your potential blind spots. Share information, discuss perspectives, and work together to make the best decisions. Remember, every Batman needs a Robin. By mastering these strategies, you'll be well on your way to becoming a bias-busting SLP superhero. Remember, fighting bias is an ongoing process, but with dedication and awareness, we can make more objective, informed decisions that truly benefit our patients. The SLP, determined to learn from her near miss with their patient, moved forwards with the rest of her day with a fresh perspective. She slowed down, actively questioned her initial assumptions, and consulted with the interdisciplinary team to gain a broader understanding of her patients. Remembering the importance of mindfulness, she approached her meetings fully present and engaged, actively listening to the concerns of all parties. The SLP also developed a systematic checklist for her evaluations, ensuring she gathered information across multiple domains and avoided tunnel vision. By embracing these strategies, she began to uncover the true cause of her patients' difficulties, leading to improved care and better outcomes. Congratulations, future bias busters. Remember, by understanding these mental shortcuts, we can become more thoughtful, effective, and compassionate SLPs. Now go out there and make a difference. Feeling like you're navigating the complex world of clinical reasoning alone? Yearning for a community that understands the challenges and celebrates the victories of evidence-based practice? Take a look at the Medical SLP Collective. We are a supportive community of SLPs who are passionate about leveling up our skills. We've got a ton of free resources to get you started, and I've included a free decision-making guideline to bust those biases. The link is in the description below. Join us today.